these women were put on estrogen alone. And in the estrogen alone group, there was a 23% risk reduction for breast cancer. Estrogen does not cause breast cancer. Estrogen is protective against breast cancer. Do you know what we see on the cells of normal breast tissue? Estrogen receptors. It's normal. It's a variant of normal. And we think that because the breast cancer cells have estrogen receptors on them, that estrogen is somehow causative. No, that's not true at all.
What if everything you've been told about breast cancer screening deserves a second look? In this episode, I am sitting down with Dr. Jen Simmons, former breast cancer surgeon and the founder of Perfection Imaging and Real Health MD out of Philadelphia. And in this episode, we're going to talk about why she walked away from traditional medicine and how she's challenging the way we think about breast cancer, screening, and prevention. Welcome back to the channel. It's Dr. Durst, and today I have a special guest with us. And so I have Dr. Jen Simmons with me today, who is an integrative oncologist, also a breast surgeon turned integrative oncologist with a story there to share, also a best-selling author with a book is The Smart Woman's Guide to Breast Cancer. And we will share links with that. A podcaster, Keeping Abreast podcast, and the founder of her medical practice in Philadelphia, and also Perfection Imaging, right? Perfect QT, Perfection, yes. And so we'll have that link in there too. But yes, I love that with the QT part of it. So welcome today. Thank you so much for taking time out of your busy schedule. So
Thank you for having me. I so appreciate it. I know we spoke about before we came on today about that you heard me speak at A4M, the American Academy of Anti-Aging Medicine. And yeah, it's really my favorite thing to do is to help everyone to make informed decisions because in general, that is not what's happening. And many of us make decisions all day long about our health based on information that we believed to be true, and it's simply not. And so I didn't set out to be a disruptor. It just so happens that that is where I landed. And it's all with the intention of people being able to make informed decisions, because at the end of the day, that's what we're promised. We're promised medical freedom, we're promised medical sovereignty, but we are forced to make decisions without the information that we need to make them.
Yes, informed decisions making, and patients are quite capable of it, right? We don't need to protect them. We need to educate them. Yeah. And so I love that. I love the term disruptor, and that you are. And so again, you're changing the way that we look at breast cancer, the whole mindset, the way we approach it, diagnose it, and treat it. And so what survive it.
Yeah.
And you have a personal history with breast cancer, which kind of drove the passion for you to branch out of that traditional field and into what you're doing now.
Yeah.
Is that correct?
So I really don't remember a time in my life where I didn't know about breast cancer. It was absolutely part of the fabric, the thread, the tapestry of my family. I come from a big family, and all of the women in my family died of breast cancer. And growing up, I had a first cousin. Her name was Linda Creed. She was a singer-songwriter in the 1970s and 1980s. She wrote all the music for the Spinners and the Stylistics. She was beautiful, brilliant, larger than life, lit up every room she walked into. Linda wrote 54 hits in all, and her most famous song was The Greatest Love of All. So Linda wrote that song in 1977 as the title track to the movie The Greatest, starring Muhammad Ali. But it really received its acclaim in March of 1986 when Whitney Houston would release that song to the world. And at that time, it would spend 14 weeks at the top of the charts. Only my cousin Linda would never know. Because Linda died of metastatic breast cancer 1 month after Whitney released that song. I was
Wow.
16 years
Mm,
old and my hero died. Her life
oh,
and ultimately her death gave birth to my life's purpose because I never wanted another woman, another family, another community to have to suffer the way that mine suffered. And so I did the only thing I knew how to do. I became a doctor, the first doctor in my family. I became a surgeon. I became the first fellowship trained breast surgeon in Philadelphia, the first oncoplastic surgeon in Pennsylvania. And I did that really well and for a really long time. I did it long
mm,
enough for my aunt to be diagnosed and long enough for my mother. And then at 46, it was my turn to hear those words. And
oh,
while sitting in the office of my friend and colleague and physician and being told that I need surgery and chemo and radiation and things that I say all day, every day without hesitation or reservation. And yet, when those words are coming at you, they land differently, they have a different meaning.
mm, mm,
And believe me, I appreciated the irony of the situation that these were things that I regularly told people. I had told thousands and thousands of people these words and given this same advice thousands and thousands of times.
mm.
But in that moment, in that time and space, all I could hear was a voice telling me, there's something more, go find it. And
Oh,
I was a conventionally trained physician, went to a top medical school, did a conventional surgical residency, was working as a program director for a breast surgery program, was head of my hospital's cancer program, an NIH accredited cancer program. I didn't
mm,
know what that something more was, but I couldn't quiet
not
this
at all.
voice. Something more, go find it. And
Wow.
so I
What?
went on a journey to find that something more, not to change the conversation forever around breast cancer, not for the benefit of figuring out how to make the world better for my breast cancer patients. This was
Hmm.
all about what this voice was
Personal.
trying to tell me. This was all about how was I going to heal myself because
Mm,
surely there had to be a better way, a different way than me having surgery and then being on lifelong medication. And so I believe that there is tremendous meaning and that our maladies are our messages. And I also am a deeply, deeply faith driven woman and that God is good. And in very short
mm,
order, I found myself in a lecture hall. This tall, lanky guy walks on the stage, big toothy grin, and he introduces himself as a functional medicine physician. Now, at this point, I had been a doctor for 20 years,
mm,
and I had never heard of a functional medicine physician. And all I could think about was, there's no such thing. What is this quack talking about? But then I remember that I'm sick,
mm,
there for a reason. So I check that big fat ego at the door and I tune in and thank God I did because I found out on that day exactly why I got sick. Got sick so I
mm,
could in that room on that day in that seat listening to this man talk because what he
mm,
was saying would not only show me how I was going to heal myself, but it was actually showing me my life's purpose, why I was put here, what I was meant to do, and how I was meant to do it. Now, the man is Dr. Mark Hyman.
mhm.
So now I can't imagine not having heard of him. But in 2016, if
Yeah,
you're a mainstream medical doctor, you have no idea who he is. And if you do
yeah,
know
right.
who he is, you think he's a quack, right?
Oh, yes. No, I've heard both sides of it. Yes.
What he was talking about on that day was
Mm,
so foreign to me, was so revolutionary to me that he was talking about the fact that in medicine,
mhm,
we are almost entirely focused on the wrong thing, especially in the world of cancer. All of our focus is on the tumor. But the tumor is
Mm-hmm.
not the problem. The tumor is the symptom of the problem. And what we think about grows. So if all you do is focus on the tumor, then all you're going to get is more tumor. And
Tumor.
unless you back up 20 steps and figure out why that tumor is there in the first place, you're never going to make anyone better. So, yes,
Mm.
if you remove the tumor, maybe you're going to delay the progression of that disease, but you're not going to change the ultimate trajectory of the health of that patient. And
No.
removing the tumor never solved anything. No one ever got healthier from a surgery. No one ever got healthier from chemotherapy. No one ever got healthier from radiation. So, what I learned on that day was that we need to think about things completely differently. We need to think about what the root cause is. Where is the dysfunction coming from? What do people have
Mm-hmm.
that they don't need? What do they need that they don't have? And start to meet them in a way that helps to drive their health going forward. Because when you drive health, disease goes away. And so I
Correct.
I get very excited about things. I'm an early
I
adopter.
love it.
So
You're
that
an
day,
innovator.
well, but maybe I wasn't then. Maybe I was just
Yeah.
someone who, by virtue of getting sick, I had the opportunity to see what wellness really is.
What
And
changed your
so,
complete mindset
yeah,
on medicine, like
yeah,
completely changed your view of
yeah,
medicine as a very solid, traditionally trained with a great career in it
yes,
too. But yeah,
yeah.
wow, what a touching story. And so with the Dr. Hyman, again, I think that I probably went to A for him the first time, probably in 2011. And again, my story isn't nearly yours, but just, noticing things and no change and no solutions ever offered in traditional medicine and just going to a first anti-aging conference and listening to the, regenerative or functional medicine practitioners. And it was a whole nother side of medicine I didn't know existed. So same story.
Yeah.
Wow.
It's
Not
eye-opening.
not yes, eye-opening
And
completely.
once you see it, you can't unsee it.
No, you can't unsee it at all.
Yeah.
No, and you become again that anti-surgery, anti-medication, and really just giving the body back what it needs. Like you said, meeting that patient
So
where they are.
I think even now, because I'm 10 years down the road, even now, I'm not anti conventional treatment. I'm
Mhm.
just on on the platform that says that is never enough. Cancer is
Mhm.
not a surgery deficiency, it's not a chemotherapy deficiency, it's not a radiation deficiency. Do some people have so much tumor burden that they need a quick fix? Yes. Are those quick
Mhm.
fixes? Yes. But you will never change the trajectory of your health unless you ask why. Why did it happen? And unless you address the whys. I, before we got on our call today, was seeing a
Mhm.
patient this morning who literally is in complete and utter denial of why she has breast cancer. And I understand because she has been repressing it for so long that I wonder if she almost can't even see it. But she's someone who, and I see this all the time, they try to um per, perf, what's the word? They try to perfect their diet to the point that we call it
Mm.
orthorexia, where they're
Mm.
so particular and strict with their diet because they think that this is the solution, that she is missing why she got breast cancer in the first place, which is that it has nothing to do with her diet. Her diet wasn't perfect, but it's fine. It wasn't the reason why
Mhm.
she got breast cancer. The reason that she got breast cancer, I believe, is that she was horribly, horribly abused in her childhood, in her
Mm,
teenage years, and in her young adulthood. And instead of dealing with that on any level, she repressed it
mm,
entirely, became a control freak. All her words, not mine. Control freak,
mhm,
perfectionist, people pleaser, right? Because if you control everything around you, you can't get hurt again, right?
mhm,
And so 20 years, 30 years of suppressing all of this, never talking about it, never dealing with it on any level, and living in this place where it's like being on 24 hours a day for years. She never
mm,
relaxes. She has no fun. She has no joy. And it's because she won't allow herself to put her guard down long enough to
mhm.
enjoy anything in life. And so now here she is with breast cancer. And I'm saying, of course, of course.
And and how do you get a patient like that to change their mindset at all about something that is so deeply lived on a daily basis,
Yeah.
leading up to the
Well,
point she is right now?
the first thing is acknowledgement, right? You have to see it.
Mhm.
You have to see it. You have to
Mm,
bring it to
true.
the
Yeah.
surface. I'm not saying you have to relive all that trauma. God forbid. No. But there are
Mhm.
wonderful ways to deal with trauma, and everyone's way, what works for them, is different. Like some people want
Mhm.
to talk it out on a couch. Some people never want to consciously utter a word about it. And there is no right or wrong way. You just need to pick
Mhm.
the way that works for you so that what happened
Mhm.
to you 10 and 15 and 20 and 30 years ago isn't
Mhm.
happening to you today, which is what's
Today.
happening with
Mm.
her. So I'm a
Okay.
huge proponent of guided journeys, medicinal
Mhm.
mushrooms,
Mhm. I
any facilitating drug, legal or
okay. Yeah.
otherwise,
Yeah.
because
I love it.
these
Yeah.
these guided journeys have tremendous benefit and impact on people. And in one 6 8 hour session, people are able to be freed from a past that has plagued them for decades.
Mm. Wow.
So I think we're going to be
That's
seeing a
powerful.
lot more data around the benefits of these guided journeys to help
Mhm.
people to change their tomorrow so that they don't have to
Yeah.
relive yesterday over and over and over again.
Well, since we're on that topic with that recent lifting of where they made it at least FDA approved here, right? I don't know if that was all or just, certain types of, but at least that was some progress
I mean,
because
it's
they
coming.
realized the benefit.
Without
Hmm.
without question it's coming, and it has to, right? We
Yes.
need it to.
And I
Will
think
it
it's
change
interesting with,
fast enough? I don't know. We'll see. But I
well, that
think
was
that
pretty
there are enough
fast, but
people. Yeah. Well,
yeah.
I mean that
Well, I was
that those
surprised though. Go
those
ahead.
studies
Sorry.
have been in the works for many, many years. I mean, the
True.
clinical trials have been happening at Hopkins for probably more than a decade.
True, but that actually brings me to one important point because it really did appear quick because they never actually ever still make a decision. We were probably 10 years out from them even acknowledging the studies until they kind of forced it from a public standpoint. But that is probably one of the things that you found. I know that when you were training and when you had your diagnosis, obviously you noticed at the same time as seeing a different way that there were such limitations to how we treat patients. And it's such an established, I think, institution is what I call it, like an established institution that's very big now and slow moving. And so when you have studies that show benefits, actually getting them to in front of a physician that can actually treat is pretty slow moving now. And so I'm sure that's kind of what you saw with everything, that the innovation is a demand from patients like yourself progressive minded patients that are ending up in your office realizing that there is a better way than what we've been given. And I'm sure that that is something that, again, you were seeing 20 years of traditional medicine. And that mindset when you sat in that first conference with Dr. Hyman is again like, who is this person? What is this functional medicine piece they're talking about? But that's how traditional doctors and traditional medicine view. But now we're making progress. So I think that it is slow moving for the studies. And so when you saw the big change, what were the biggest limitations that you had to face almost immediately in the way that you were now seeing breast cancer, but also treating breast cancer? What were the biggest limitations at that time?
Well, I think at that time, just getting people to know that they had different options, right? Um, I remember thinking, if you build it, they will come, right? That I was going to walk away from
Mm-hmm.
surgery and single out, and people would be beating my door down. And probably one of the biggest lessons that I learned is that, we're all trained to be really good doctors, really good providers, but
Mm-hmm.
we are not trained to be business people. And nowhere along the line does anyone teach you that side of it. And when I was a surgeon, I didn't need a funnel. I had a funnel. It was anyone who
Mm-hmm.
had a breast mass, anyone who had an abnormal mammogram. They were beating my door down. I had a 3-month waiting list. It wasn't,
Mm-hmm.
eh, having a funnel wasn't a thing for me.
Yes.
But when you're out there on your own, especially someone who's trying to do things differently than how they're done
Mm-hmm.
in mainstream medicine, you need to be a marketer, you need to be a business person, you need to think about it completely differently. And we're given no skill set to do that. No guidelines of where to start or how to grow or any of that. So
Mm-hmm.
I worked just as hard. And remember, when I did my functional medicine training, you essentially have to start over from zero. Yes, I was an expert at surgery. And yes, I was an expert in the area of conventional breast cancer treatment, but not
Mm-hmm.
in integrative medicine, not in functional medicine. I was starting over. I was a newbie. So not only was I out there doing things that took me a long time and made me feel uncomfortable and all of that, but on top of it, I had to figure out how to drive business. So
Mm-hmm.
those first few years, and then of course, COVID was in the middle of that. So those
Mm-hmm.
first few years were very, very challenging for a whole host of reasons. Not to mention that I walked away from a career with tremendous financial security and into a
Mm-hmm.
realm where I had no idea if I was going to make, $10, $100, or $1,000, right? Like I
Correct.
had no financial
Mm.
certainty at all. So that was
Correct.
a
Yeah.
very, very,
Mm.
very stressful time in my life. But no one said this was going to be easy. And
No, but it,
and you learn, right? Like you don't learn from your successes, you
yeah.
learn from your failures. And I have plenty.
Correct. And I think when it's your passion, like, so I think that that changes everything. So we actually probably have a lot more we didn't talk about this before we got on, but just a lot more in common because again, 20 plus years in a very solid, traditionally, trained emergency medicine was what I was doing. But again, I just noticed changes and branched out into business. And I didn't think the gap was as big as it was. So what I did have a side hustle when I started. And I knew that at some point I'd want to go all in, but it was right when COVID hit. I had just opened up I did it kind of as a side hustle and then opened up my first location. And then COVID hit. We launched in March of the end of March 2019, and then COVID hit. So I thought, well, I don't know how this does either. But again, the gap was so big that I had to think a lot of people change, whether it's time, it's money, it's balance, but it was passion for me. And I would say that, just like you, I mean, it feels like it was the right thing for you. It was completely the right thing. This was your calling, is to change how we approach breast cancer.
Mhm.
So when it's your passion, it does fuel you learning
For
everything,
sure.
and it doesn't even become work any longer,
Yeah.
right?
That the medicine part, I don't want to say that it was easy, right? But the
Yeah.
medicine part definitely was invigorating, right?
Yes.
I
Yeah.
was so excited about what I was doing, and I so deeply believed in what I was doing, and it absolutely fueled my fire. The business part of it was more scary
Scary.
for me than anything else because
Mm-hmm.
as physicians, most of us, not all, most of us are perfectionists. Most of us do like to be in control. And
Mm-hmm.
this was something that was so foreign to me because as a surgeon, like most surgeons these days, I was employed. I
Employed.
worked for the
Mm-hmm.
hospital. I didn't run my own
Yeah.
practice. All of my employees were employees of the hospital. I didn't do
Mm-hmm.
payroll. I didn't do any HR. I didn't do their management. I
Mm-hmm.
showed up to work every day, and thank God, there was a staff there to assist me. So I really had no idea how to do any of this. I'm still probably doing some of it wrong. I'm like, what's that form I need to fill out again? What do I need to file
Yeah.
again? It's not easy. And
Yes. It's
there's a
not.
lot of AI assistance, but in 2016 that didn't exist.
Correct. And it is way more time consuming than you ever guessed from that standpoint. I
Oh,
agree. Yes. Now you know why people don't do business because it really took perseverance beyond what I had ever imagined
it
before. But
did.
but when it
And it's
comes
a,
to your
and it's a
why, like,
totally
yeah,
different skill set, incidentally.
yes.
Totally
Do you
different skill
love the
set.
business aspect of it and the marketing? Do you love that part of
No,
it? Oh, you
no,
don't? No.
no,
All
not at
right.
all. I am
Oh.
some I find it very, very hard to sell me. I
Mm.
for whatever the reason, I'm uncomfortable with that. And you have to be really, really good at selling you.
Well, I think that you do a great job of it, but not because so you wouldn't know you're uncomfortable, but you're not selling, you're just educating and like you're just sharing your passion. So to me, I think then it just is a natural
Yeah.
sell that you don't
And then
even think
and then my
you're doing.
marketing team is like, "You have to give them a call to action." I'm like, "Oh,
Oh, yes.
yeah."
Yes. Yeah. This
Like,
is
"What
true.
do you
Wow.
want them
This,
to do with the information that they're giving you?" And I'm like, "Oh, yeah, I do need to do that." But it does not come natural to me. Like,
correct. Well,
I
that's
wanna
why you
tell you
have
about my
them.
book, and then I forget to tell you to buy my book, and I wanna tell you about my
Yes.
podcast, and then I forget to tell you to listen, and I wanna tell you how to recover and heal after breast cancer, but then I don't tell you how to get access to what you need.
Yes. Well, I
I'm just
think though
bad
that
at
they're
that.
still when they listen to you, they're going to look for those links and whatever they're on. And that's why you have a marketing company so that they can do all those things for you. And you do what you do best, which is, educate patients. And so, and I'm going to give you an opportunity to do that now. I know that this is such a hot topic. And again, so why do you think what do women need to know about the why they get breast cancer? You brought up one thing, past traumas and emotions, but the other physiologic things that they don't think about, what are some of those?
Yeah, and I wanna start off by saying, I think everyone needs to think about their why. It's of the utmost importance, but that it is
Hmm.
never about blame or shame, right?
Okay. Yes.
So there are some things that cause breast cancer that I never want people to feel badly about, because some of
Mm-hmm.
them they did unknowingly and some of them they did very knowingly, but maybe they
Mm-hmm.
didn't know that there was a connection there. I think about alcohol a lot,
Mm-hmm.
and not because I want to drink it, because it is a major cause of breast cancer.
Yes.
A lot of women don't know. So I remember, um, I think this was right around the COVID time where alcohol consumption increased exponentially during COVID.
Oh
I
yes.
don't have
Yeah.
to tell you that.
Yeah.
So
Yeah.
this I had this patient who was a nutritionist. She's like an LA nutritionist, and to the stars. So, and she was also like a nutritionist slash personal chef. So she was making, I don't know how many meals for how many stars who were, locked up in their house and couldn't cook or couldn't get their food delivered or their staff wasn't there, whatever it was. She was making a lot of
Mm-hmm.
meals for a lot of stars.
Mm-hmm.
And she liked to drink wine while she was making her meals. So she went to a place where for about a year and a half, or maybe a little longer, she was drinking a good amount of wine every single day. And at the end of that road, she noticed a lump in her breast and got worked up and had breast cancer. And so about maybe a month or two, we start to work together and we're talking about the causes of breast cancer, and we get to talking about alcohol. And she said, yeah, I drink wine. I said, oh, how often? Oh, every day. And I said, you drink wine every day? Yeah, I have a couple of glasses while I'm preparing all of this food. I said, are you aware of the connection between alcohol consumption and breast cancer? And she said, well, all I'm having is a glass or two every day. And there was no connection in her head between alcohol consumption and breast cancer. And
Mm-hmm.
because she didn't see it as a problem for her, she couldn't see that it was connected in any way. And I want to tell you that she ended up firing me because I
Mm-hmm.
was blaming her for her breast cancer, because in
Mm-hmm.
her mind, the amount of alcohol that she consumed could not possibly be a problem, and I was the problem. And this is not a unique story, but
Mm-hmm.
alcohol, and listen, if people want to blame me and blame the messenger, that's fine. I just want you to hear the message, right?
Mm-hmm.
And the message is that there is no safe amount of alcohol for women. And it has to do with our liver, our liver's capacity to manage toxins, and the fact that as compared to men, our livers have to metabolize a lot more toxins at baseline, right? Because we
Mm-hmm.
have our hormonal system is far more complex than theirs. And
Mm-hmm.
we also, by virtue of our society and values and that kind of thing, we happen to expose ourselves to many, many, many more toxins than men do, right?
Mm-hmm.
Because personal care products and just how we live our lives, we are
Mm-hmm.
exposed to a lot more than men, a lot more. So when you add
Interesting.
alcohol into that mix, and your liver then has to metabolize the alcohol. Alcohol is broken down to something called acetaldehyde, which is directly toxic to cells. It can damage DNA. It can be that first step in the generation of a tumor cell. And
Okay.
so as we as we expose our liver and ask our liver to deal with toxins, your liver is always going to detoxify the thing that can affect you most and can affect you worst, right? It's always
Okay.
going to
Yeah.
prioritize life. And so alcohol is one of the biggest toxins that we will ask our liver to face. So
Mm,
it takes 8 hours for our liver to metabolize alcohol. And while it's doing that, it's not doing the rest of the things.
mm,
So kind of a double
makes
whammy
sense.
for us in that it's not allowing us to process the other environmental toxins. And while it's processing the alcohol, it's creating something that is highly, highly, highly toxic to us.
Taxing. Right. Yeah.
So alcohol is just one of those things that people generally don't think about in conjunction to breast cancer, but it is one of the top modifiable risk factors for breast cancer.
Okay.
There are other toxins that generally we don't think about, like what's happening in our mouth. We so often disconnect our mouth from the rest of our body. And I think that
Hmm.
that is a mistake that we made from an educational standpoint in instead of having medicine and dentistry be one track, we made it into two separate tracks and somehow pretend that they're separate. I firmly believe that we should all go to medical school together. And then if you want to do dentistry, that's its own residency. But that
Hmm.
we understand that the mouth is the window to the soul, that the mouth is the window to the body, that there is a great book by Dr. Jerry Curatola called The Mouth Body Connection, because
Okay.
these are connected. And we know that if you have gum disease, you're at increased risk of chronic diseases like heart disease, right?
Hmm.
And
Hmm.
there's also mounting evidence that chronic infections in your mouth by way of having root canals and leaving dead teeth in your mouth is a source of chronic inflammation and infection, and it will literally drain your immune system. And breast cancer is the intersection between cellular damage and an immunocompromised state.
Yeah.
So if you have a
Mm,
infection happening in your mouth and your immune system is just focused on keeping that infection at bay so that you don't have systemic effects, that's just a constant drain on your immune system. Uh,
mm,
thing is metal amalgams. So mercury fillings are a
true.
metalloestrogen, and no
Mm,
one's thinking about this. So while we're all so quick to blame estrogen, which incidentally is not carcinogenic, and estrogen
mm,
does not cause breast cancer, but mercury amalgams are. They
mm.
can directly destroy or alter or mutate DNA, and they can be that initiation of breast cancer.
Well, it's interesting too because again, from an ER standpoint, they also don't pay because they have to pay because it is separate. You bring up such a good point because it is separate and it costs so much to go to the dentist. There is so untreated mouth disease and infections. You're right. Like it was widespread and you couldn't even get somebody to treat them if they came into the ER with a bad infection. It was hard to get them in to follow up. So no, you point out such a good point I never even thought about before that it should have been one track. But estrogen, I know that you talk so I loved your talk at A4M because I love the innocent bystander concept of estrogen. And that was what your talk was about. So I think that everyone thinks of estrogen when they think of breast cancer, especially if they're thinking of hormones and hormone replacement therapy. They automatically default to it causes cancer. I know you hear that all the time, but also estrogen is the culprit. So tell us a little bit about the just innocent bystander,
Yeah.
because I
Well,
loved that
it's
concept.
a very convenient narrative because if estrogen is the cause, then
Hmm.
anti estrogen drugs are the solution. And when we take a woman's estrogen away, we create a low estrogen state that is materialized in a woman not being able to think, not being able to sleep, being anxious, being depressed, having palpitations, having joint pain, joint aches, losing their bone density, gaining weight, having urinary tract infections, having chronic yeast infections, vaginal atrophy, painful sex, lack of libido. You see where this is going, right?
Mm-hmm.
And it
Mm-hmm.
sets the stage for somewhere, 5, 10 pharmaceuticals, and not
Oh,
just
yes.
short-term drugs, long-term, lifelong customer
Oh,
situation here, right?
yes. Yes.
And so it is a very, very profitable narrative from the standpoint of the pharmaceutical companies. And they are more than happy to continue to perpetuate that thinking, that narrative.
Mm-hmm.
It just so happens to be entirely false. And if you need not look any further than the study in which the whole narrative came from. Because when you look at the Women's Health Initiative and you look at the subset of women who were hysterectomized, meaning that they no longer had a uterus because it was
Mm-hmm.
removed for fibroids or for whatever the reason, these women, because they believed that they didn't need progesterone, which is a whole other conversation for another day,
Mm-hmm.
but these women were put on estrogen alone. And in the estrogen alone group, there was a 23% risk reduction for breast cancer. People need to hear that.
Not,
Estrogen
yes.
does not cause breast cancer. Estrogen is protective against breast cancer. Now, the reason that they get away with the narrative of estrogen causes breast cancer is because they use that confusion around the fact that
Mm-hmm.
70 to 80% of breast cancers are what we call hormone positive, meaning that when you
Mm-hmm.
look at the tumor under the microscope, we see estrogen receptors on the tumor cells. Do you know what
Mm-hmm.
we see on the cells of normal breast tissue? Estrogen receptors. It's normal. It's a variant of normal.
Mm-hmm.
And we think that because the breast cancer cells have estrogen receptors on them, that estrogen is somehow causative. No, that's not true at all. And the
Mm-hmm.
analogy that I used at A4M was, when you see a firefighter, when you see a fire, there are firefighters there, but the firefighters didn't cause the fire. Their presence is not indicative of causation. It's the same thing with estrogen and an estrogen positive breast cancer. The estrogen didn't cause the breast cancer. It had nothing to do with why the breast cancer initiated. The fact that it's there now, it may help that cancer to grow, but it had nothing to do with initiation. And what
Mm-hmm.
happens with a tumor once it forms, it creates an environment. We talk about it, we call it the tumor microenvironment. It creates an
Mm-hmm.
environment around it that is estrogen rich to supply those estrogen receptors to allow those cells to survive, because a tumor is just breast tissue in survival mode. It's not some
Mm-hmm.
foreign tissue, right? Like, we don't want to fight breast cancer. There's been enough fighting. The breast cancer is there because there's been enough fighting. What we want to
Mm-hmm.
do is to remake that environment so that it fosters health rather than creating disease. And what people don't realize, and why those anti-estrogen drugs don't work on everyone and don't work forever, is
Mm-hmm.
because that same estrogen receptor is happy using estrogen, but it's also happy using insulin, insulin like growth factor, NF kappa
Mm-hmm.
B. Like, it will find any port in
You
its storm, right? It is
okay.
going to use alternate pathways if there's no estrogen there. So if depleting estrogen were the thing, we would have solved this. That's not the thing.
Mhm.
And the
Yeah.
thing is figuring out why the cancer is there in the first place. The thing is restoring the environment to one of health and taking that
Mm.
stress chemistry that is dominating in a woman with breast cancer and transform it to the chemistry of joy. And that's
Wow.
what we're doing at Jen Simmons, MD. And that's what we're doing at Perfection Imaging and Wellness. So this is my moment to like tout myself is that we are not
Yes.
focused on the tumor. We're focused on why the tumor got there in the first place. Because when you create wellness, disease goes away. And there is no drug, there's no anti estrogen drug, there's no surgery, there's no chemotherapy, there's no anything that is going to help you to restore balance. And if we are going
Mm.
to recover from breast cancer and not just survive, but
Sorry.
survive in a durable way and actually thrive afterwards, we have to lay a foundation that your health can build on. And that's
Wow.
really why I wrote The Smart Woman's Guide to Breast Cancer. I'm basically
Yeah.
giving you the instruction manual for how to restore your health
Join your
after a
health.
breast
Wow.
cancer diagnosis.
Wow, I just love that. The whole mindset change, just and the comprehensive approach, because that's what women look for. And I think once somebody gets a diagnosis of cancer, again, just like you said, if you're thinking about the tumor is going to grow. Also, they can't, and it comes back to that fighting or breast cancer survivor when you see it on a billboard and you're driving by it. I feel like once somebody's given that cancer, diagnosis, they become fixated on that word. And you really have trouble getting them out of that mindset. So you really are working on just having them focus on everything else but,
I
the
am.
illness, the tumor, the cancer.
I really try to get away from the war and the fighting and all those words and all that
Mhm.
mentality because if you've gotten to that point where you have a diagnosis, you've been fighting enough. And it's time for
Mm.
peace. It's time for love. It's time for gentleness. And
Mhm.
fighting won't serve you.
Wow. I love that. And it would really actually, even from a logical standpoint, as I thought about the WHI, and if it wasn't just common sense that it didn't cause it, in 2002, when the WHI came out, we literally shut down hormone replacement therapy. And the trajectory of breast cancer did not change. It continued to rise. So clearly
It
there
got
was
worse.
externals.
It got worse.
Yes. Yeah.
Yeah.
Yeah. So
Yeah,
we
we had
we we stopped it.
millions of women stop taking their hormone replacement, and the only
Yes.
thing that happened was that breast cancer incidence rose.
Yeah, it just kept continuing to go up. No change whatsoever, yet a
No,
complete shutdown of hormone replacement therapy.
yeah,
Yeah. But what you were talking about is, and even now using bioidentical is different, but obviously that even just the study, the fact that when you brought up progesterone, which again, we talk about so frequently, and you don't hear a lot about that on social media, not as much as estrogen. You always hear about estrogen. But that progestin was a synthetic that you were using in the other arm, where they would only put them on a progestin, which was the synthetic version of it, if they had a uterus. So there still is that mindset in medicine that if you don't have a uterus, you don't need progesterone. So we still haven't gotten out of that, but that was the arm of the study that actually showed, again, not the amount of breast cancer increase. It was a 1 in 1,000 risk of increase, not the 25% that they reported, but still, that's still that mindset. Even with progesterone and bioidentical, there's still that mindset that you don't need it if you don't have a uterus.
absolutely. Well, this is part and parcel to the fact that we have we have undereducated in terms of hormones because you cannot trademark a molecule of nature. So
Mhm.
the bioidentical hormone story is largely untold in medical training
Mhm.
because of that. Because
Mhm.
our educational system is entirely built and delivered by the pharmaceutical industry.
Mhm.
And anyone who doesn't realize that is kidding themselves. So
Mhm.
we were never taught the full story of progesterone and what it does and why it's so important. And I have repeatedly said breast cancer is not a disease of hormone excess. Breast cancer is a
Mhm.
disease of hormone deficiency. And the reason that we're seeing it younger and younger is because our hormonal dysfunction is happening younger and younger. Because as we
Mhm.
become more stressed and as we become more toxic, we're making less
Mhm.
and less progesterone and seeing more and more breast cancer.
Mhm. And what about the progesterone receptors? That's a common question that we'll see all the time because not only do some of the breast cancers have the estrogen receptors, which somewhat addressed. Obviously, that's just the tip of the iceberg. There's,
Yep.
you deep dove into that a lot more in December and A4M, but progesterone receptors are present as well. And
Mhm.
I think everyone
Don't you
misunderstands
think it's
that as
curious
well.
that we don't have progesterone blockers?
Mhm. Yes,
The
I do.
Right?
There's a
The
reason.
reason that we don't have progesterone blockers is because progesterone is actually protective against breast cancer. It's anti-proliferative. And so they know that if we just say no to progesterone, that it will do the same thing as giving them a drug. So we're essentially taking women who we know um, won't make enough progesterone to protect them, and we're keeping them in that state.
Mhm.
And
Yes, and then
it's really terrible. And when the providers are asked by the patients who have done the research and have heard that progesterone is not only anti proliferative in the breast, but it also has sleep benefits and mood benefits and anti proliferative benefits throughout the body and calming and that kind of
mhm,
thing and repair. And then they ask the doctors who let me tell you, these doctors are very well intentioned, but they take
mhm.
it for face value. So they think progesterone receptor positive, okay, progesterone helps this tumor to grow. You can't take progesterone. Like they don't know what it means, they don't know what it does. And so
Yes,
instead of saying, I don't know, they say no.
yes. Well, and
And
I
it's
also
really
think, though, that
unfortunate.
it is, but after we leave our training and we're out in practice, there's societies. That's where that institution of medicine, in my mind, starts to get bigger. There's societies that help us have guidelines. They write guidelines, right, to help the physicians that are out in practice. I think that's kind of our way of, early on probably educating, and there were, educational events related, but now those are all pharmaceutical backed. And so really the messaging from a lot of those guidelines, if you look at their funding and all their meetings, it's pharmaceutical backing. And so essentially, that is the guidelines that the physicians are getting. And so you really have to branch out like you did or like I did to really learn a
Mhm.
whole new way of medicine,
Yeah,
which again,
that's
I think is super refreshing that there is a health focus and then there's that preventative aspect of it. And I'm not against traditional treatments either. Once obviously there's something that's there that needs to be treated, but there's just so many other aspects that you can do to assist in
right.
that.
We're not throwing the baby out with the bathwater, right? There's a time and a place, but that we all have to acknowledge that
Mhm.
conventional methods alone are never going to be the entire solution. Even in, let's think about something that seems so cut and dry. In the orthopedic realm, you break a bone. Yes, you need an orthopedic surgeon to help
Mhm.
to repair it and that kind of thing. But now think about what we know now. So my son, who is a big burly football player and every week has a new injury, all of football season, he's on BPC 157.
Mhm.
And 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 I that I am making sure that his diet is on point. I am saying like
Oh, yes,
it's
yeah.
time to go to sleep and taking his phone away, and because we know that there are
All
so
day.
many things outside of conventional medicine and the understanding in conventional medicine that are really going to help him heal. So
Yes.
even in those
Oh, yeah.
areas where conventional medicine is offering most of the solution, it's still not the whole story. And in the
Yeah.
area of chronic disease, it's I'm not even sure that it's part of the story in that if someone has type 2 diabetes, they don't need more insulin. They've already seen so much insulin in their body, they need to remake their
Activity.
diet so that they have
Mhm.
glucose control. They need
Mhm.
insulin sensitivity, not more
And
resistance,
and
right?
activity,
Yeah,
lots of
and
activity. Yes,
activity,
yeah.
right? They need
Yeah.
to remake how they utilize glucose and the amount of
Mhm.
circulating glucose they have. And that comes from what you eat, what you drink,
Yes.
how you move, and how you sleep. That's it,
Yes. Yeah.
right?
No, I think it's a
And
very comprehensive. Yeah.
yeah,
It
and
it
there's
takes
no
all of
amount of
that.
insulin coming from the pharmacy that's going to change that or fix that. And I think,
Yes. No.
Casey Means proved with her whole Levels platform something that we believed was impossible or we were taught was impossible for decades.
Mhm.
We were told that you can't
Mhm.
reverse diabetes. And she went out there
Mhm.
and said, "Watch me." And she did.
Yeah, I think if anyone really learns that alternate pathway to, better health and optimizing, it's there. I mean, there's so many now physicians that are like innovators leading the way in certain specific areas, you being breast cancer,
Mhm.
but like Mark Houston with cardiovascular and, Hyman is doing all of it. It's just amazing that there are ways. And I always just look, we do hormone is kind of the core that we'll do, but we do peptides, but it's all just tools and lifestyle changes are definitely part of that. And you have to have that conversation with patients, but it's not always easy. I'm sure that a lot of the patients that are coming to you are still kind of in between, like the traditional, approach, looking for something more, but maybe not completely anti traditional, because a lot of times a lot of patients that come to me are healthy, but they're also anti-medicine, anti-surgery, but they don't have a reason to be of that mindset, so they're just progressive minded, looking for other solutions and taking their health into their own hands. But you probably have a mix, right, of some
I
patients that
do have
still
a
have
mix,
the doctor
although
time.
although they're coming to me because they're at least curious and they want to
Yes,
do everything that they can, right? And
love
I
that.
have the spectrum. I have the
Hmm.
people that are all in the conventional side and want to know what I can do to make conventional medicine better. And I have
Okay.
people all in on whatever they call it, the natural side or the holistic side or whatever. And they won't even hear you about maybe
Hmm.
we should consider this, and everyone in between. And that's okay because we as physicians, I don't see that paternalistic relationship working anymore, right? Do as
Mm-mm.
I say is it doesn't lead to a good outcome for anyone. We
Mhm.
are more guides, we're more
Mhm.
facilitators than anything else,
Mhm.
partnering with our patients. Yes,
Mhm.
they are looking to us for guidance for sure, but I can't make anyone healthy. I don't know about you,
Yeah.
but that's
Yeah.
not in my skill set.
Mm.
I can I can guide you, I can advise you, but health doesn't happen in a doctor's office. It doesn't happen in a hospital and in any
Mm-mm.
kind of medical setting. Health happens at home with what you do every single day. And
Yes.
the only person that can make you healthy is you. There's nothing that I
Yes.
can say or do to make you healthy. You have to do the thing,
Yes.
as my friend JJ Virgin says. You know, you
Mm-hmm.
can't read about the thing. You can't take a course on the thing. You got to do the thing.
You gotta do the thing, yes. We had her on way back on the podcast. She's awesome. And no, I agree. You only have control over yourself. And so, yes, we always just say the same thing. We're here. It's their journey. We're just here to, and again, I can get pretty passionate about what I believe, but I'll just give them facts. At the end of the day, it's an informed decision that they're
Yep.
making. I
Yep.
just feel like they just need the facts. And sometimes it's different than what they want to hear or what they've heard before, but it's just information so that they are equipped to make their own decisions, but informed
Yep.
decision making. You're right.
And
That is
it's
the way it
being a
happens.
facilitator or a trusted guide.
Yeah. Yeah. Yeah.
That's the way.
I know that we don't have unlimited time, or I would definitely approach lots of different subjects and we could probably talk for hours just on progesterone or estrogen alone. But mammogram, I saw your recent podcast talking about mammograms, and so tell me a little bit so that
People
patients,
get
because
sweaty.
again, yeah, well, and it's interesting because I recently had a friend who does hormone replacement therapy with us, and she was headed out of the country for a period of time. She had her mammogram. There was high density, so they did the usual. They did the mammogram, they did the ultrasound or the MRI after, and then they found a little spot that looked suspicious, not low risk, but they ended up doing a biopsy. Then came back no cancer cells at all, not even precancerous, but then they wanted to do a further biopsy because that still could potentially. And she just texted and, said, "What do you think?" And I said, "I think, are we ever allowed to not have the diagnosis? Like, are we ever allowed to leave without the diagnosis?" Because again, even with a biopsy, it was precancerous. But again, I'm not that. It was just a question. Obviously, I would never oppose what the physicians here were recommending when it comes to hormones. Then we'll have conversations. But again, the mammogram is the start of it, and it seems as if we get a lot of patients that have some abnormality and then are overdiagnosing and overtreating. So I'm sure that you have some strong thoughts on that.
I do. I mean, we should probably start with the American College of Physicians um, position paper that came out on April 17th. And I'm
Okay.
going to quote something from that paper. The United States Prevention Task Force found that compared with no screening, mammography resulted in no difference in all cause mortality, regardless of age. Let that sink in. Compared to no screening, compared to doing nothing, mammogram resulted in no difference in all cause mortality. Mammogram is not
Mm-hmm.
saving lives as compared to doing nothing. Now, this should make everyone so uncomfortable. Everyone should
Mm-hmm.
feel horrified by this statement because we have been told for decades, more than 5 decades, we have been told that mammograms save lives. And it's simply not true. It's not true.
Mm.
And
Wow.
I will get flooded with messages, hate messages of how dangerous I am and how I'm going to kill
Mm.
women. And in fact, the American College of Radiologists and the Society of Breast Imagers did respond to this position paper, which was printed in the Annals of Internal Medicine. So we're not
Mm-hmm.
talking about fringe journalism here. Okay.
Mm-hmm.
And the American College of Radiology and the Society of Breast Imagers response was, you're going to kill tens of thousands of people by putting out this statement. Not, here are the facts. Not,
Mm-hmm.
here is how mammogram saves lives. You're going to kill people. So
Yeah.
the reason why they
Kill 'em.
didn't respond with facts is because the facts don't exist. And the bottom
Mm-hmm.
line is that despite the messaging, which is brilliant, the messaging is brilliant, it's just not true.
Mm-hmm.
Mammograms
Mm-hmm.
neither save lives nor save breasts. And this is published in major, major journals time and time again. Because when we look at the population statistics, it just doesn't work. It doesn't work.
Mm-hmm.
It is identifying women with lesions that would have never gone on to become anything, right? So it's
Mm-hmm.
overdiagnosing. And
Mm-hmm.
no matter how many mammograms you do every year, the same number of women die of breast cancer. No matter how many mammograms you do every year, the same number of women present with aggressive disease, and that is the
Mm-hmm.
vulnerable population. And the only thing mammogram does is find good cancers. Cancers that, if not found on mammogram, would have not been they're not positively affected by having found them on mammogram, that they would have been taken care of if they would have presented and people would have had the same treatment and the same outcome regardless of whether it was found on mammogram or not. That's the
Okay. Yeah.
population that mammogram is identifying tumors in. They're identifying tumors in women without aggressive disease. And that's the population that it doesn't matter, that you can wait to
Gotcha.
see if they present or not. But this whole, we have been duped for generations to believe that finding things early is meaningful. But when you look at the data, it's simply not true. And that is part and parcel because when we look at autopsy studies, and there have been autopsy studies in the 1980s and 1990s, the 2000s, the 2010s, when you look at all comers, women who die of things other than breast cancer, they're dying in car
Mm-hmm.
accidents, overdoses, suicides. If you look at these women and their breast tissue under the microscope, 1 in 5 women, 20%, will have microscopic evidence of breast cancer. It doesn't mean they have breast cancer. And we have equated finding a tumor with saving a life, but it's simply not true. Finding a
Mm-hmm. I
tumor
think
does
that's.
not mean saving a life.
Mm.
And when we create all of these patients, we are not
Mm-hmm.
saving their life. And in some cases, because treating for breast cancer increases your risk of other diseases like cardiovascular disease, like neurodegenerative disease, like osteoporosis, if
Mm-hmm.
you're treating the breast cancer but causing these other life threatening states, you haven't saved their life, you've cost their life.
Mm. Yeah, that's so the key being right there, like leading to everything else is diagnosing a tumor does not save a life.
That's right.
That is like,
And
yeah.
that's why it's so important to use more sophisticated modalities to both image the breast and to assess the patient. So at Perfection Imaging and Wellness, we are not just doing a scan. Yes, I'm very famous for talking about the QT scan, but the
Mm-hmm.
QT scan is about more than just imaging the breast in real time. Because yes, we do see things that are not seen on mammogram, and we see the
Mm-hmm.
things that are seen on mammogram. We see calcifications, we see masses, we see cysts and solid and architectural distortion and all the things that are seen on mammogram. But we also have the ability to follow these in a way that mammogram can't. And
Mm-hmm.
a bonus, no compression, no radiation, no pain, right? So in what feels like a
Mm-hmm.
spa visit for your breast, we're actually able to image you. And if we find something, we can bring you back for a short interval study, 60 days, 90 days, 120 days, and re-image the breast and measure a doubling time. And we know that cancers or things that are meaningful have lower doubling time. So if it has a doubling time of 100 days or less, we know that that is something that needs our attention, that that's something that needs intervention. But if it has a greater doubling time, we know that this is almost certainly something that's benign, and we watch it.
Oh,
And we're not giving diagnoses to people that don't need diagnoses. We're not giving diagnoses to people that don't have the disease. They just have
that don't
microscopic
need treatment.
findings. Who
Uh,
cares?
Yeah.
Right? And at the
Yes.
same time, we're not we're not abandoning these people. We're not throwing caution to the wind. We're following
Mm-hmm.
them and making
Yeah.
sure that they get the help when they need the help, right?
Gotcha. And can people reach out to you if they want to have scanning done? Is it through your office there in Philly or through
Yeah,
Perfection
so you
Scanning
just
if
go
they
to
wanted to have?
perfectionimaging.com, and perfection is spelled with a QT in the middle,
Yes.
PERFEQTION, imaging.com. And the other thing that we're doing is we're doing biologic assessments. And this is what we talked about a little bit at A4M, where if we
Mm-hmm.
were screening for metabolic health with the same intensity and persistence that we're using mammogram, we would prevent
Mm-hmm.
a lot of diseases, not just breast cancer. We would prevent diabetes
Mm-hmm.
and hypertension and heart disease and Alzheimer's and all the things, right?
Okay. Yeah.
So
Yeah.
we are doing a metabolic assessment when you come in to perfection. We're looking at your body composition. We're measuring those metabolic health markers that we know are associated with dysfunction, that are
Yes.
associated with the start of disease, that are actually present way before you would see disease on your studies. So we're looking at metabolic factors. We're also looking at inflammation. So we're examining your
Mm-hmm.
tears and looking for the inflammatory precursors to breast cancer, things that we would see years before a diagnosis. And we're
Mm-hmm.
using that information to actually prevent disease, to prevent a diagnosis. Because at the end of the day, I
Wow.
am far more fueled by being able to prevent a diagnosis. Of course, I want to
Mm-hmm.
help women survive disease. Of course, I want to
Mm-hmm.
help women thrive afterwards. There are 4 million survivors in this country right now, and I want to help them, believe
Wow.
me. But I also, more importantly, want to prevent women from ever having to carry that sign, from ever having to
Wow.
carry that burden. And by
Mm.
screening in the way that we're screening at perfection, we can do that.
Wow. I love that. Yeah, and you can tell how passionate you are about it, but I agree. So they can actually get a workup that's comprehensive when they get there. So not only can they get reassurance with a better scan, but they can also get some metabolic testing that helps guide them to
Yep,
prevent lots of other diseases.
yep.
Wow. Well, and so how do patients get in touch with you, Dr.
It's
Jen
all
Simmons?
at
So,
perfectionimaging.com, and perfection is
okay.
spelled with a QT in the middle. And then I'm constantly putting information out there. So you can follow me on YouTube, you can follow me on Instagram, on Facebook, on TikTok, on LinkedIn, on
Mm-hmm.
all the things. I'm at Dr. Jen Simmons, and my Jen has two N's. And if you want the Smart Woman's Guide to Breast
The
Cancer,
book,
it's available
yes.
on my website. It's available on Amazon. And I have my own podcast. It's called Keeping Abreast with Dr. Jen. And we put a new episode out every week for you to consume and hopefully share with someone else that needs to hear it.
No, I think that's awesome. And I wanted to make sure that you got all the information out there so we could find you because you already made it clear that you weren't always good at the end at doing that, and neither am I. But I think that your podcast is on all the podcast channels, but also do you have that on YouTube as well? And video, or is
Yep.
it mainly on audio that they're okay? So they can find you all
Yep.
the ways.
It's everywhere. We
All
try our
right.
best.
Yes. Well, I can tell you that her, again, she was impressive. We went to A4M, and my nurse practitioner Faraday and I were sitting together when we watched you talk, and you did an amazing job. You were the best speaker the entire conference.
Oh,
And again, I thought that it was also just surprising that there weren't anyone, you just were phenomenal. Like, again, the whole topic, the bystander, the innocent bystander. And again, you're very passionate and it comes out, and the information is so powerful. So thank you for educating and for being passionate about educating and helping women. We need physicians like you that are just innovating. And again, that is the face of medicine going forward. How do we prevent? How do we change how people like approach their health and get more physicians out there like yourself helping patients?
well,
So,
I think that we just need to use our voices. And
mhm,
unfortunately, as people have their own experience, that it
mhm,
is an eye opener. It really is.
mhm,
And not that I want anyone to suffer, but we need to hear our messages. And that is
mhm,
what most maladies are. They're just our messages.
mm. Wow, that is powerful. A lot of what you say is. And so I so appreciate you taking time out of your day. I know it's a busy practice that you have up there, and you're doing all the other things as well. So thank you. And if you guys have any questions about breast cancer, about how to find Dr. Jen Simmons, again, any questions, experiences you want to share, let's start a conversation in the comments. So drop them in, and now you know how to find Dr. Simmons. And we will also put everything in the description link as well. But thank you so much, and we'll follow along and make sure you get the book. I had just started reading it after A4M, didn't get all the way through it yet, but it's just so informative, and it's definitely for women, not only that have a breast cancer diagnosis, but anyone that wants to know more about it and how to prevent it. It's for
Mhm.
all women. So
It is.
thank you so much for being you.
Thank you for having me. This was really wonderful, and I look forward to doing it again.